Hi, I'm Mitch. I'm the student physical therapist assistant. This is Carla, my sample patient. And we're just going to act like she's having some problems with her upper trap. Which basically is a little tight on the left side. So the upper trap runs from the back of the head and goes all the way down to the lateral 1/3 of the clavicle. So it's really a triangular looking muscle. And so the muscle belly is right in this area. And to ensure you're on it, you can either have them side bend. As long as you're on the back lateral half, you should be on it. Or you could have them rotate away, and that should activate the upper trap as well. And you're going to want to use some free up for patient comfort and help them as much as possible. And we're just going to help try to relieve some pressure and some tightness in this muscle. So first we're just going to start, I'm just going to work on one side. And you're just going to use some downward and upward pressure and just loosen it up. And you can really feel the muscle belly right in here. That's right it. Just try to help loosen it up. And since she is tight on this side, after a couple minutes, you can have them eventually side bend this way. So it'll put that active sufficiency, and it'll make it even tighter. So it's going to, then we're going to loosen it up some more by just helping the muscle relax. That's the goal of this entire treatment. And you should always check for your contraindications before. So if there's any bone in the muscle or anything like that, if there's any ligament instability or any problems of that sort, just always check before with any treatment. You're going to use firm pressure. It's going to be about 3 to 4 seconds each stroke. I might have been going a little too fast there. We're just using a kneading petrissage. And you're just using basically a circular motion. And you're just putting half pressure and then you're slowly relaxing it. And then just have her relax, go back to neutral. And if you are able to get this way, she's not quite off table enough, but you can just use it and massage that way as well, using your thumb on the back half instead of the front. And we're going to do this for about 4 minutes. And you also can apply a little bit of a stretch after you do the massage. So have her turn her head in and then do it, and you'll really feel a stretch, especially if you flex and do it, then you'll really feel a stretch right there. And where do you feel the stretch? And that's right where the muscle belly of the upper trap should be. Just gonna have you relax. We're gonna go back to the massage. And then here's about right where the clavicle is, so that's where it's ending. And you can feel the muscle belly end. And you would you could do it 2 times at once, but you'd use more cream. Make sure your head's directly neutral. Relax shoulders, arms at the side, and then you'd be able to just do both. But you or the patient can tell you which side's more tighter, depending if you need this one done, just like the rectus spinae muscle. You're just going to do circular motions. Let the muscle relax. If you want to do a stretch on this side, then you would just turn into, side bend this way, and have it pull the head up. And that would do an appropriate stretch of the upper trap that way.
There you go.
Right there, right? Mm-hmm. How's that feel?
That's good.
Okay, now if we were looking for a trigger point, say our 4 minutes is up, then what you're going to do is you're just going to slowly trace down the muscle, which goes all the way from the skull to the lateral 3rd clavicle, and we're going to tell her, you can either feel the tightness, or she could tell you where the tightness is, the patient. And so let me know if you feel some tight or some point tender areas.
Go down inferiorly a little bit. Yeah, right there.
Right there? Okay, so that would be where a trigger point is. And so all we're going to do is just hold there. You can use index finger or 2 fingers. You're just going to hold it there for about 10 seconds. And then relax. Stretch. And then see if it's still there. Is it still there?
A little bit.
A little bit. All right, we'll do it again.
I think the pressure just needs to be a little firmer.
A little firmer pressure. So it is pretty firm pressure with trigger points, but if they feel it needs to be a little tougher, every patient is different. So you have to make that classification with each patient. Let's hold here. 10 seconds, help it relax. All right, we'll see what range of motion's like, see if there's any pain. Is there any pain or any areas?
Nope.
Try to move your neck, no pain?
Nope.
Why don't you actively try to side bend your neck, see if,
Same side?
yep, just this side, yep. Any pain?
Nope.
Okay, and so that's pretty much just the trigger point release and the upper trap kneading. And always worry about patient comfort, and if you're working in vulnerable areas, make sure they're at most comfort and